All right, let's talk about something that's a total game changer for any medical professional: signposting. This is the art of using really simple phrases to guide your patients and colleagues through complex information. It's how you make sure you always sound clear, structured, and completely professional. Just think about it for a second. When you're in a consultation, you have so much crucial information to get across, right? But how do you make sure your patient is actually following along with your train of thought? From talking about symptoms to explaining the diagnosis, and then finally to laying out the treatment plan. Without a clear path, it's so easy for important details to just get lost. And see, that's the thing, right? Your medical knowledge can be top-notch, your grammar can be perfect, but if the patient can't follow your logic, the message just doesn't land. Our job isn't just to inform, it's to be a guide, turning what could be a confusing mess of information into a clear, simple path they can actually follow. So here's what we're going to cover. We'll start with why communication can be such a challenge. Then we'll define what signposting really is. After that, we'll dive into how to use it to direct conversations, build logical arguments, and get total clarity. And finally, we'll talk about the huge professional advantage this gives you. Okay, so first up, the communication challenge. In a medical setting, the stakes are, well, they're really high, aren't they? A simple misunderstanding isn't just a little awkward. It can seriously affect whether a patient follows their treatment, it can impact health outcomes, and it can damage trust. Clear connections between your ideas aren't a nice to have, they're an absolute necessity. So, what's the fix? Well, that's where signposting comes in. I want you to think of these words and phrases as your verbal GPS. They're like the road signs in a conversation that tell your listener exactly where you are, where you're headed next, and how all the pieces connect. Basically, they keep everyone from getting lost. So, to put it simply, signposting language is just the collection of words and phrases you use to organize what you're saying. Their whole job is to give your ideas structure, to manage the flow of the conversation, and to show the listener how everything connects. Now, these little phrases are doing some heavy lifting. They're not just filler words, you know? They are specific tools for specific jobs. You can use them to introduce a new topic, to smoothly change the subject, to explain a cause and effect, or to wrap up an idea. Each one has a clear purpose. All right, first, let's dive into how you can direct the conversation. This is all about using certain phrases that put you firmly in the driver's seat, so you can control where the conversation is going with real confidence. Okay, let's compare two really key moves here. On one hand, you can introduce a brand new topic. You're opening a new door in the conversation by saying something like, in terms of your blood pressure. Or you can consciously close one door and open another with a phrase like, moving on to your lifestyle habits. Both are really clear, deliberate shifts that keep everybody on the same page. So here are some of the most useful phrases for your toolkit. When you want to introduce something, you've got in terms of or regarding. To switch gears, moving on to is perfect. And if you need to circle back to an important point, to go back to, or as I mentioned, works wonders. Okay, next up, building a logical case. This is absolutely crucial, especially when you're explaining a diagnosis or a treatment plan. You have to connect the why with the what happens next in a way that's just airtight and super easy for the patient to grasp. For example, when you're giving a reason, a simple phrase like, "this is because," is so powerful. It literally tells the listener, okay, pay attention, here comes the explanation, and it leaves absolutely no room for confusion. And then, right after you've given the cause, you hit them with the effect. The signpost, as a result, makes that connection crystal clear. It creates this unbreakable logical chain. Because the kidneys aren't working right, the result is fluid buildup. It's simple, it's direct, and it's incredibly effective. The trick is just having these phrases ready to go in your back pockets. So when you need to give a reason, you can pull out, "this is because," or "due to." For results, therefore or consequently are perfect. To give an example, for instance, is great, and to show a different side of things, however, is your go-to. All right, our final set of tools is all about adding that extra layer of polish to make sure your message is completely understood. These are the signposts that make complex information feel structured and just easy to digest. You know, explaining a plan with sequencing words like first, next, and then is just incredibly effective. It turns what could be a confusing jumble of instructions into a simple step-by-step process. The patient knows exactly what's coming and in what order, and that builds a ton of confidence and really cuts down on their anxiety. And it's not just about sequencing. You've got other great tools for clarity. You can generalize with phrases like overall. You can clarify something by saying to put it another way. And of course, you can wrap things up neatly with to summarize. These are the phrases that tie it all together. So why go to all this trouble? Why does mastering this one skill matter so much? Let's get into the payoff, because this is about way more than just sounding good. It's about being a more effective clinician and, frankly, a much more confident communicator. When you use signposts, you automatically sound more organized and more confident. But more importantly, it helps your patients understand and trust you. And hey, if you're prepping for exams like the OET, this is exactly the kind of skill that examiners are actively looking for. It's a huge win. Look, if you take away just one thing today, let it be this. Small phrases create big clarity. That's it. You don't need a huge, complicated vocabulary. You just need these simple, effective tools to guide your listener. So, I'm going to leave you with a question to think about. In your very next conversation with a patient or a colleague, which one of these new signposts are you going to try out first? Just pick one. Start small, and I promise you, you will see a huge difference.